Over the last year, I've had the pleasure of working with the Office of Disease Prevention at the NIH. Our mission is to enhance the public health by promoting the scope, the quality, and the impact of preventative health supported by the NIH, by increasing its visibility, the rigor of its review, and by helping identify and address research gaps in prevention research at the NIH. Our goal is to address the leading causes of mortality within the US. Looking at this graph, you see that mortality by cause, you see that the non-communicable diseases, such as heart disease and cancer, dominate this. If we were looking 100 years ago, this would be dominated by the infectious diseases in red. And with that change comes a change in how we think about preventative health. Prevention health science supported by the NIH takes on many forms, from covering the whole spectrum of preventative health care. The NIH research covers things such as vaccine development, development of screening tests for novel genetic risk factors, creation of interventions to prevent risk behaviors, or increasing uptake of evidence-based practice. But how do we select what things to cover? Do we prioritize the leading causes of mortality, like the top graph? Or do we look at the causes of chronic disease, such as the lower graph? Do we prioritize current health problems or future health problems? These are the questions that we hope to address by working with our stakeholders throughout the NIH. When we're looking at all of our different NIH partners, as we see here, we organize them in our Prevention Research Coordinating Committee. And these partners have organized into 5 different areas, focusing on the genetics of prevention, screening of both adults and children, as well as looking at environmental and policy level implications. We also work with our partners in our Pathways to Prevention program, where we use these same features to coalesce our NIH partners into, oops, sorry, I'm a little ahead. Another way we do this is our Pathway to Prevention program, where we organize these into certain question areas where we work with our NIH partners along with our federal partners such as the CDC and the PRCC to help promote, oh man, all right. But this is actually a drastic change for me, where I started off as an immunologist studying cellular populations, but over the last year I've developed a lot of different skills, such as text mining, where we were allowed to learn how to subset the mountains of grants into specific areas, and where we've learned that I'm doing the same thing as I did before. But I've also learned how to form creative partnerships, looking at how things like trust, intergovernmental forces help drive collaborations within the NIH as well as abroad. And then when we're looking here, what we see is that infectious diseases no longer dominate what we do as a preventative healthcare organization, but rather these non-communicable diseases are the important part. So we need to change from preventing outbreaks to changing lifestyle behaviors to promote health. And I hope that at the NIH and in our office, we can help do that. Thank you.